So anesthesia errors are something that we've been prosecuting for many decades. Anesthesia errors come about in several ways, generally during the administration of general anesthesia when a patient is put to sleep. They can also come about when the patient is receiving spinal anesthesia, that is a needle to the spine in the back. Either one of those can cause complications.
The anesthesiologist is breathing and controlling the patient's heart function when they are under anesthesia. And that requires looking at all of the different parameters in the patient's vital signs to make sure that they are adequately protected. And the cases that we see with respect to anesthesia often involve inattention on the part of the anesthesiologist, not paying attention to a change in the patient's heart rate, a change in the patient's breathing pattern. Those are the most common types of anesthesia errors that we see. Anesthesia is a very dangerous part of the medical rubric, so to speak, for patients. It is something that requires a lot of attention and care by anesthesiologists. So probably the most common type of anesthesia case that we see is the failure to properly monitor the patient during anesthesia and the failure to recognize that the patient is having adverse consequences as a result of the anesthesia.